Spiritual care is facing an uncertain future in Saskatchewan as a result of recent cost cutting in the provincial budget. This week, there's a national spiritual care conference happening in Saskatoon. Spiritual care is something that is available in every province in Canada, paid for people of all types of religious stripes, even those who are atheists. So what's happening in Saskatchewan's hospitals? Tom Powell joins us. He's a retired spiritual practitioner and co-chair of the Canadian Association for Spiritual Care. Hi, Tom.
Hello, Jill. Good to talk with you.
Nice to talk to you, too. First, share with us how spiritual care practitioners help people.
Well, it's quite clear that in any kind of healthcare setting or any kind of institutional setting, when people arrive in these institutions, they're going through some kind of crisis, and spiritual care workers are there to really guide them, to support them, to listen to them as they try to work through this new reality for them, whatever the reality is. If it's an illness, for instance, obviously people are questioning their own life and what life will look like from here on in, and so a visit with the professional spiritual caregiver allows them to explore their lives and what that might mean.
In your experience, do most people make use of this kind of help that's available when they are in the hospital for all of those reasons you spoke of?
Absolutely, Jill. I was a chaplain in the Saskatoon Health region here for about 20 years. Retired now, but very busy with people, and not necessarily people who claim religion, because a religious person has his or her own faith community to rely on. But a good portion of Saskatchewan people claim no religion. And so, but when they get, as I said, when they get into these institutions, then they are hurting and they need help.
What's happening in Saskatchewan with these funding cuts?
Well, the provincial government saw fit to basically eliminate all spiritual care funding, public funding for all spiritual care. I think they've done a bit of a backtrack, I'm not sure, but I think they have around long-term care. But in terms of acute care sector, the cuts still stand, which means in effect then that these people who are well-trained professional caregivers, who are a valued part of the healthcare team, are simply losing their jobs. And that means that a good portion of Saskatchewan residents will no longer be receiving spiritual care when they come to the hospital.
So you have the conference with national people from right across the country attending. What are some of the topics that are coming up, in particular about where spiritual care is headed in Saskatchewan given these cuts?
Well, let me just talk about the whole conference, if you don't mind.
Sure.
I'll do this very briefly. Like, we spent the first evening trying to develop an action plan with relation to the Truth and Reconciliation Commission recommendations. And we had visitors from the Indigenous community, and they were great. We just had a great evening with them. So they helped us to look at the Truth and Reconciliation Commission recommendations and how it is that we might develop an action plan around that. Very important for us because, again, a number of people who are in hospital are of Indigenous origin. And so, you know, we need to know what they are going through and how it is that we might be of assistance. The other topic, the main topic, has to do with physician-assisted dying, so that's been another very main topic. And we had a person talk to us yesterday who is a nurse and a PhD in her nursing career, and she was telling us about pain management. And then this morning we had an oncologist talking with us about his practice of and how he has experienced the need for this kind of assistance in healthcare system.
Is the role of spiritual practitioners changing because of the rules around assisted dying?
Absolutely. Well, I guess it's changing. I think back in my career, I certainly was asked, I would say even on numerous occasions, about dying. I even had people that sometime asked me to pull the plug, which I didn't do, by the way, but they wanted that done. So people need help in trying to understand the system, trying to understand death itself and other possibilities, just what the whole thing means and what life and death is all about.
There are some big questions, and I can certainly see the value of having folks like yourself there to support people in those moments of need. Thanks for your time today, Tom.
Thank you, Jill. Appreciate being here.